Hello, everyone, and welcome to the Canadian Institute for Public Safety Research and Treatment's virtual town hall series presented by the COVID-19 Readiness Resource Project. My name is Emily Kosick, and I'm the Knowledge Manager at CIPSRT. Our topic today is Leadership and Mental Health, Part 2. Today, we're going to quickly review some of the concepts from our previous Leadership Town Hall, and then we're going to move on to some questions that have been pre-submitted. If you have a question, you can use the question box to send it to us, and we'll answer as many of them as we can. Just a reminder that this town hall is being recorded, so if you miss something, you can watch it again later. A quick disclaimer, the views and opinions expressed in this virtual town hall present and belong solely to the speakers and are not necessarily endorsed by the University of Regina, CIPSRT, or its sponsors, or the speakers' respective employers or organizations. This presentation reflects the knowledge that we currently have based on the panelists' experience and review of the literature, which may differ in either a specific context or may change as new research findings become available. So we just like you guys to keep that in mind. Now I'm going to go ahead and let the panelists do a brief introduction, starting with Randy Mello.
Thanks, Emily. I'm Randy Mello. I'm the Chief of the Paramedic Service in Peterborough, Ontario, so one of 52 municipally operated paramedic services in our province. I'm also the president of the Paramedic Chiefs of Canada. So that's an association that represents leadership of paramedic services in each of the provinces and territories. And I've had the great fortune through Paramedic Chiefs of Canada to also be involved with CIPSRT, the Canadian Institute for Public Safety Research and Treatment, and have been on the Public Safety Steering Committee now for a number of years. So very interested in bringing our views to this. So thank you for having us here.
And so with us today, sadly in voice only, is Ken McMullen. So Ken, if you'd go ahead and introduce yourself.
Well, thank you very much. They always said I had a face for radio, so I guess that leads to the reality that our camera issue wasn't working this morning, but I do apologize. Thank you so much for the invitation. My name is Ken McMullen. I'm the Chief of Emergency and Fire Services here in the city of Red Deer, Alberta. And we're a combination service. I have the privilege of overseeing the fire service, our EMS service, as well as our 911 communication center here in the city. I have the privilege of being the vice president of the Canadian Association of Fire Chiefs. Like Chief Mello had indicated, I also represent that organization within CIPSRT. And I'm currently the co-chair of our Public Safety Steering Committee within CIPSRT. So again, thank you very much for the invite. I've had the privilege of working with both Randy and Dr. Camp in the past, and I look forward to the next hour sharing with you.
Right, okay, so Dr. Ron Camp, I'm going to turn it over to you to do a brief introduction for yourself.
Thank you, Emily. So I am Ron Camp. I prefer Ron to doctor at the moment. Thank you very much. So I appreciate the expression of respect there, but I think we're all on a first name basis. I am an associate professor of leadership and governance at the University of Regina in the Hill Levine Schools of Business. I'm also the co-academic director for the ICD Rotman Director's Education Program in Saskatchewan. It's a partnership with the University of Toronto Rotman School of Business and the Institute of Corporate Directors. I've had the incredibly good fortune of being involved with Ken and Randy for about 2.5, 3 years now through CIPSRT. I'm a member of the Academic Research Committee, which is a group of scholars across Canada that are working on mental health issues. What's fun for me is that I get to work in the intersection of leadership and mental health. And one, it's nice because I get to apply my undergraduate education, but two, it's nice because this is an area where I think that we're underserved in our understanding of how the role of organizations is affecting mental health. CIPSRT and the scholars associated with CIPSRT have done some really interesting research in the last couple of years where we're drawing out some of the factors with organizations, with teams, with leaders that are actually affecting the mental health of public safety personnel, but it also means that there are things we can do to improve the mental health as leaders in public safety organizations. So as a continuation of a webinar we had a few weeks ago, where Randy and I got to talk about some of these, we're going to start with a brief recap of what we started with the first webinar on leadership and mental health, where we're talking a little bit about the environment in which public safety personnel operate. We refer to this as a VUCA environment, where there's high levels of volatility, where information is unknown, where what we're dealing with is incredibly complex and complicated. And a lot of the information we do have, if we can find it at all, is kind of ambiguous. It's subject to multiple interpretations. And as Emily said in the disclaimer, we're working the best we can with the current research information and current experiential information we have. And so we've seen with COVID-19, that's evolving in a very rapid place. So we get in the situation of, but you're telling me that it's different today than it was a week ago. And he's asked, so you're wrong. Well, we were wrong then because we didn't know as much. And so part of the nature of VUCA environments is we're always a little bit behind where we need to be, but we still need to make timely decisions and take actions. That creates a lot of uncertainty, and it creates stress and anxiety for the people that have to do that. So we know that in the current pandemic environment, we're dealing with huge amounts of uncertainty, which is leading to stress. And as the stress goes on for a prolonged period of time, it creates long-term anxiety for public safety personnel. So what we're hoping to do as we move into the notion of the role of leaders and the things that they can do, we're going to help provide some hints and tips as we address the questions today on concrete things that leaders in public safety organizations can do to reduce the stress for the members of their services and thereby improve the mental health or the possibility of good mental health for their employees.
I think that's such an important opening point to this conversation, Ron, about the current environment, the current VUCA environment. We know that for public safety personnel, our environment is always uncertain. And we know that uncertainty, and as it says on the slide, underlies stress, anxiety, and both operational and organizational are sources of stress. And we know as leaders in normal times that we have sort of those three levels of stress, and we have different abilities to address those levels. So critical incidents, we're going to see them. We have very, very little ability to affect the frequency at which we see critical incidents. We know there's effects of those on our personnel. We know we have operational stresses, as the slide says, and we have some limited control over those around addressing call volumes, adding resources, equipment issues, finding time for people to get breaks. But the organizational piece that we have actually the greatest control over has the greatest impact on the stresses of our public safety personnel. So we have control over that and providing consistent leadership and psychologically safe space. But in this current environment with the pandemic, that level of uncertainty is something we've never actually seen before. So I think as we make decisions around when we talk about the principles of leadership, we have to have in mind how the pandemic has affected this VUCA environment. That level of uncertainty is something that we've never ever experienced. The ambiguity of a virus that we don't know much about. We don't know if you can get it a second time. We don't know, it's an invisible threat, and the level of uncertainty is just, it's so much higher. And I think it's so important for leaders as we think about the next slide and these roles of leadership to understand that role has changed with this VUCA environment.
Right, I think you raised a good point with this uncertainty and the timeliness of decision making. We need to step back and take a little more time just paying attention to what leadership is and what we need to do as actions. And as Ken and Randy will get into it in a few minutes, the nature of how we address some of the emergent situations, the operational issues, has to change because we're worried about the bigger picture of community safety. And we have to be more focused and intentional about that. Ironically, so we've got to slow down and be a little more thoughtful in order to make more expedient decisions. Right. Which seems counterintuitive.
Sorry about that, Ken. Is there anything that you want to add to that?
Yeah, no, thank you so much. And I think what I would add to that, and it really supports what's already been said by Ron and Randy, but I think one of the other compounding issues with this particular pandemic is the unknown risk that our staff are taking home. And there's always been a mental health component to what we do. But I think what's been really unique about this one, and primarily in the early days, is the unknown about what are the risks that I'm presenting myself as an employee facing COVID type calls, but equally as important is what is the risk that I'm taking something home? And for the first time, we talked about isolating staff. We talked about providing RVs for frontline workers across Canada so that they didn't have to enter their homes. Well, you want to talk about stresses, that was something we've never even talked about before.
Right, and the outcome of that, of those stresses and this uncertain environment, are our own natural intolerance to uncertainty, the reaction is that we behave differently. And Ron, I'm sure, would be able to do a much better job of explaining this than I can, but we'll start to see that in our personnel, that they because of that level of uncertainty and stresses around that, they start to have different reactions to stimulus. So there's a tendency to see things as a threat. So when I communicate to my staff in this uncertain environment under these additional stresses, if there's anything ambiguous in my communication, there's a tendency to see a threat in that. And when they are uncertain about how a situation is unfolding, I think there's a tendency, Ron, correct me if I'm wrong, but tendency to recall bad situations in the past and assume the outcome is going to be a bad outcome again. And so I think as leaders, we have to think about that in the way we apply these roles of leadership that you see in front of you, and look for triggers, or I guess clues, in our communication back from staff that help us to see that this level of uncertainty is causing those reactions in different ways.
And the reaction is really a survival mechanism, right? So if the environment is dangerous, it makes more sense from a survival perspective to look for those cues that you're not safe.
Right.
And so that gets into the ambiguity that if the communications from leaders are ambiguous, then there is a natural tendency to protect yourself, to look for where the danger is coming from. Right. So as the uncertainty increases and as people become more fatigued, and you're hearing more about nightmares and insomnia that people are coping with in general, and families of public safety personnel are having this even worse, it snowballs. Yeah. And so I think it becomes more important from a standpoint of a leadership role to be looking at this envisioning, aligning, and inspiring role and your communications, that you need to be more clear and more explicit about what the big picture is, what the big goals are, what our values are, and help make sure that people understand how they're actually implementing those in ways that are keeping them and their family and the public safer. And why we're doing things differently than we were, because it fits with the big picture as we get more information and understand things better. So I think Randy's exactly right in that.
Yeah, this is sorry if I cut Ken off there, but this is where it's interesting to me, is how we've tended to focus when we're envisioning. We tend to focus on subordinate goals rather than the superordinate goals. So for my world, and probably Ken's as well, we focus on response times, stopping a clock. For the fire service, I'm sure there's property loss measures. There's, obviously there's always protection of life, but a lot of that are subordinate goals that actually in the current environment kind of are out the window. We talk about response times, but it's a kind of a confusing message to our staff when they get to a scene and now stand back and take extra time to put on personal protective equipment or change the protocols that we have with patients, medical protocols. Things are very different. So, this first bullet on this is really the big picture bullet to me is really an important one that I think we need to ensure that staff are aware of what the actual superordinate goal is and connect their work towards that. Because really some of our previous subordinate roles, accepted goals, I should say, really are out the window in this environment.
Right, I think they are.
Anything to add to that?
Yeah, no, I agree with Randy on that particular one when we're talking about response times and the new reality in regards to, like you had said, the change in protocols. We've done some things on a fire medical first response perspective that we hadn't done in the past, where we would always support with the 4-person engines on our critical medical events, and they would just go into the residence and do what we do to support our medics inside those structures. And we've changed that. We now do a doorstop quick assessment. And at first there was a real change. There was a real concern that, oh my gosh, that stopwatch that we've all been relying on for such a long period of time isn't the same process anymore. So we have to really clear up what our expectations on, and really to your point, talking about some of that has gone out the window. I would agree with you.
And another issue with the big picture, I think we were talking about this the other day, was that we have different front room, back room personnel, as it were. And it's not always clear how the back room personnel in, say, a paramedic service are actually a critical part of making sure that the paramedics and the firefighters stopping at that front door are actually getting the support they need to be able to do what they need to do to effectively support community safety.
Anything else you want to say about roles of leadership before we move into questions, Ron?
No, I think we've got a good background on the questions coming up.
So our first question is, how do we operationalize these leadership roles to create good working environments? And so I'm going to start with Ron on that one.
So nice academic question here. Thank you. I think what we do is we communicate more. I think we need to be thoughtful. I think we need to, as Randy was saying, take the time to figure out what our superordinate goals are. And it's not just a matter of the chiefs or the superintendent saying, this is what it is. I think it's more a matter of the chiefs and the deputy chiefs and the superintendents and whatnot getting together with the staff and saying, okay, what are our real values here? What are the real big picture goals that we need to be addressing? Because the practice does need to change to make sure that everybody is as safe as they can be.
I mentioned.
Sorry, Randy, I'm just going to go to Ken first for his answer.
Sure.
Oh, that's fine. Thank you. And I agree that I think that communicate is right up there as our top initiative as a leader. But I challenge us and as leaders in our organizations to find new and innovative ways to do that. I know certainly for myself in this department in the first weeks, I was over communicating, and there was a degree of complacency to that getting into it. So we slowly transitioned to doing webinar-based town hall meetings. And I think that with that communication, there is a degree of vulnerability. And as a leader, there were times I had to say, I don't know. And there's times that I'd have to say, things are likely going to change tomorrow or the day after that. And what we believe is true today may not be what we believe is the truth tomorrow. And it really had to ebb and flow. So I'm completely agreeing with Ron that communications and communicating as much as possible is of the utmost importance. But I also would suggest that we have to find new and innovative ways of doing it and to show that with a bit of vulnerability.
Andy, your thoughts?
Yeah, I'm glad Ken jumped in there because that's exactly where I was going, was the new and innovative ways. So I think when you look back at the three principles, first of all, the envisioning piece, as we said before, making sure that we really have clear and connected vision to what that superordinate goal or mission is, and making sure that our staff understand how they are connected to it. So I guess that gets into the alignment piece, how they're aligned to that bigger picture. So I said in the previous webinar that I had made mistakes around that. I had, during the pandemic, opened up a new program, and I connected an importance to that program being successful to continued funding. And that actually got down to the floor. People were hearing that as my goal. And they found that issues that were happening, some of the small problems that happened along the way, were irritant because they were probably interfering with what they thought my goal was, and that was continued funding. And they saw some of their work as being futile. And we had to take a step back and use some of the communication styles that Ken was just talking about to connect their work to the real superordinate goal, which was being out in the community, checking for COVID-19, decreasing the chance of viral spread, and saving lives and saving the spread of this thing. So I think it's making sure we have clear connected goals, finding alternate ways to communicate, keeping in mind those interpretational biases we have in a VUCA environment. If I send out a blast email from the chief, immediately without clarity, there's an assumption, okay, something bad's coming down from the top. So we've changed to having, as Ken mentioned, the town hall type meetings. We're doing a Facebook live message, basically from home after work sometimes, and giving people clear, very transparent and very comfortable messages, telling them exactly what our PPE levels are, being very transparent, but doing it in a way that is comfortable for them. People are used to Facebook. They haven't had really bad things happening from there. Messages from the chief could be a bad thing, but this is a different method that actually increases their comfort level as they hear the messages from us. So a lot along the same lines as what Ken and Ron had just said.
If I could for a minute, I'd like to tie a couple of things the two of you said together. Ken, could you say for a minute a little bit more about the vulnerability piece? You're uncomfortable and you're communicating that. What are you communicating when you're in that vulnerable moment?
Well, I think like the staff, Ron, I communicate my fear. I can communicate my concerns. And likely this originated in the very early stages when little was known about COVID, little was known about the transmission of what was happening with COVID. So when I talk about vulnerability, it really was about showing the fact that as a leader, I will be proud and I will be professional and I will be as prepared as I can be, but there's going to be opportunities where I too am struggling with some of the answers, and I too have to face very quick decisions, and I'll get into that likely as some of the questions go. But I know in our province particularly, not unlike others, the provinces were rolling out their relaunch strategies, and they were very, very high level without the details of how to make those things happen. And so we were all in that very reactionary state of how to implement a phased a re-entry, as an example. And so again, I think that vulnerability, Ron, hopefully I've answered your question, is about just being truthful and honest that I too was struggling with some of the things that we were facing together.
Well, I think you answered that beautifully, actually. I think what I want to get to is the point that Randy was raising earlier around psychological safety. In this situation, we don't know the answers. We don't know all the processes and protocols ahead of time. We're creating the answers as we go along because we're just learning what the environment really is and what we really need to do. But there's an expectation. In my experience dealing with public safety personnel, there's an expectation they know what to do and they're in command of a crisis. They're in control. And the reality is we're not in control here, and it makes us even more uncomfortable and creates more anxiety. And I think it's critical that people like Ken and Randy are actually creating space and creating an understanding that we're all struggling through this. We're all doing the best we can. We do the best we can in the moment, and that's good enough. And so it's okay for you to say, hey, I don't quite get this because, well, the chief doesn't quite get it either. And it's the new normal.
Fully agree. Well said. Thanks, Ron, for summarizing that.
Yeah. Thanks, Ken. We'll move on to our next question here. It is, how can you effectively manage staff in different locations? So it's entirely possible you will have some staff in support roles that are working from home virtually and some that are on the front line. So how do you balance that as a manager managing staff in two different situations? And I'm going to start with Ken on that one.
Well, thank you. In preparing for this, I almost had to reword the question to say, what does productivity look like? And so I can tell you that in our organization of 225 staff, we are doing all the things we're referring to. We have some working from home. We have many on the front lines. You take our communication center, where we were bound very early on by the COVID restrictions that we not introduce engineered controls to allow for the social separation to occur. And so our dispatch center has, in essence, been broken into two locations for the last 2.5 months, and likely will be for a foreseeable future. I think that if I was to give you my thoughts around how do you manage that, it's now a lot less about outputs and more about outcomes. And I think that the reality is there's a degree of trust. You have to trust your staff in a new way that we're not necessarily all comfortable with. There are that management style that likes to see their staff being productive and like to see what is happening and like a busy office, for example. And this is really going to challenge you because your staff are in a different location, many different assignments being assigned to them remotely. And so there is a degree of trust. So for myself, if I could summarize it, we set expectations. We provided the tools in order for you to meet that expectations, and we keep people accountable. And we keep people accountable by doing check-ins, by really checking what is the status of the work that they've been assigned to do. And that was done on a weekly basis. It wasn't a daily basis. But I assure you that we have staff that felt as though they were underperforming and felt as though they did not have the ability to just look over their corner and ask somebody if they needed help with something. And we're still struggling with that today. We have not returned our staff into our admin headquarters. And there are some folks that are still struggling with what have I been able to produce on behalf of the organization. And we've had some good conversations around what does productivity look like and being patient with that, understanding that my expectation as the chief has changed. as a result of COVID-19. And thank you for doing what you're doing. And it just is a little different now.
Your thoughts on this one?
Sorry, you cut out. Were you going to?
Oh, sorry, Randy, can you hear me?
Yeah, absolutely. So yeah, that was fantastic, Ken. You hit some points that I had thought about. It takes investment and it takes patience for a couple of things that I had thought of right from the start. You have to invest time in ensuring that you have good open lines of communications established. So we've gone to morning meetings that we didn't do before with virtual attendance from multiple sites. Those working at home check in every day. We spend a really bit of social time, actually having a chat first before getting into an informal agenda every day, and making sure that we have that communication every day, so we understand what everybody's up to, what are their issues, what do they need for support from the team, but making sure that you've invested in open bilateral communications each day and having patience and understanding. It's really interesting for our service. We've looked at work from home strategies in the past and came up with a lot of reasons why we didn't think it would work, and then we were forced into doing it, and it's worked exceptionally well because we have had patience and investment in communicating and ensuring that people are connected. It's really worked well, and it's really just around having patience and having an investment in the time it takes to communicate.
Any thoughts on this question?
I think, in general terms, it's very important when you look at this connection that you're making sure you're connecting people to the overall purpose and big picture vision for the organization. So just because you're home doesn't mean you're no longer working for the paramedic service, right? But as you both said, you've had to modify some expectations. What is it we expect to see people doing? How much productivity do we expect to have from them in what areas? I think, one of the things we look at for productivity is, did people show up and say something in meetings? Well, was that really productive, or was that just, I didn't know how else to manage things, and so that's what I learned to look for, so that's what we did. From a goal setting and mental health perspective, I think there's a lot of research that says if people see themselves as being an important part of the organization, it's good for their self-esteem, it's good for reducing anxiety. Because I'm comfortable here, I belong, and I contribute. So I think one of the challenging things, though, is when you're not seeing some of that tucked away work at home, that you're not giving people the feedback that, hey, what you're doing is important, what you're doing is appreciated, and I appreciate what you're doing. And actually, Randy, the other day you were saying that you've actually come up with an interesting way of helping to cope with that, and acknowledging your appreciation for what your staff are doing.
Yeah, you're exactly right. And that, I think I'm really glad that you pointed out that last piece around making sure that everybody was still connected to the vision and the mission of the organization. So I think you're referring to, we kind of just had a late check-in point. We did a little bit of work up front to try to acknowledge everybody's participation in our greater vision and our goal, our mission as an ambulance service, but we just wanted to kind of touch base and make sure everybody still felt connected. So we did it was a thank you card to every single one of my staff with signatures on it, and we created a challenge coin that was a COVID-19 challenge coin. And I sent a message out about how important everybody's contributions are to achieving our mission. And I actually printed out probably the first 6 or so of those cards before I realized I had said paramedic on it and not mentioning all staff. And so we changed that. So every staff is now connected through that little thank you and then this little coin just to commemorate the collaboration, not to point out, not to remember COVID, but to point out the importance of our collaboration and our teamwork as we move towards the vision. And that also kind of prompted us to think about things like, our schedulers aren't in the office. They're not getting a thank you on a regular basis and seeing how they're contributing. So we've even included them in some of our social media messaging, taking a snapshot of our scheduling software screenshot without names on it and posting that in our Twitter account to say, without this, we can't get to this. And the next picture was the paramedics out on the road. So I think that's so critically important in managing people who are in different locations, is like you said, connecting them to the work, to the vision, to the outcomes.
Great, Randy, thank you. So I'm going to go to a question from our audience. So you guys haven't seen this one. So they're asking has there been some thought towards how staff will interact or be okay with people coming back to work if they've had COVID-19? and if there's any uncertainty about whether they're actually coming back healthy or not. So Randy, I'm going to let you start on that one.
Yeah, so yeah, it's a really good question, and we've actually had lived experience on that. We have had an individual who was positive, and interestingly enough, I'm not a professional who could really get down into the details of how this works, but there are people who will test positive repeatedly because they're still shedding a dead virus. It's not actually something that can be spread, but they'll show a positive test. So we also have gone to bringing people back into the workforce based on time-based clearance. So they'll have a positive test, and instead of waiting for negative tests, they'll bring them into the workforce at a 14-day mark without ever having a negative test. So obviously there will be anxiety around that. And, so the ways to address that, we're certainly just going right back to what is the evidence, what is the science behind it, giving an explanation, acknowledging the feelings, acknowledging there's a fear there, and acknowledging it's an uncertain time. But all we can really do is rely on what evidence we have and sharing that with staff and personnel as we come back. But again, we have to balance the needs for privacy and confidentiality of the person coming back as well. So it's not an easy thing to transition somebody back in, but be prepared, do the homework, look for the evidence. We have great people in our medical officers of health out there who will help us to give us evidence-based guidance on returning people to the workforce and how to communicate that.
And any thoughts for the organization?
Yeah, I'm going to echo a lot of what Randy said as well. I think you find your trusted sources, and in our province, similar to everybody else, we rely so heavily on our Alberta Health Services, Medical Officer of Health in our province. Internally, we are fortunate to have an occupational health and safety nurse that has really helped us navigate some of these uncharted territories. I would suggest that the anxiety around people that have been impacted, that are returning to the workforce, has gone down in recent weeks. And what I mean by that is there was a lot more unknown 2 months ago than there is now. It's still not easy. I 100% agree with Randy. It's about communicating. It's about being open and upfront with your staff, but also maintaining that confidentiality. We can't lose sight of that. I think that in society, we have witnessed, I believe the number was 97,000 cases of COVID across Canada, and so many of those have returned to their workplaces and back into a normal society, that anxiety that was faced 2.5 months ago is not as high as it is today, would just be my suggestion on that.
Hey, Ron, do you have any wrap-up thoughts, or do we want to move on to the next question?
Well, I think there's one point that's been missed, which is that most of our offices were doing something to reduce transmission of disease in general, right? So I walk into the CIPSRT offices and I've got hand sanitizers at every entranceway, and I've got them near the washroom. So it's like everywhere you go, you can sanitize your hands. You look at the housekeeping staff there, and they're not just vacuuming and dusting anymore. They come into offices and they're wiping things down every day, multiple times. You go into grocery stores and they've got the plexiglass shields in place. There are all kinds of things that we're doing to create barriers to transmission of the virus. It's safer than it was 2.5 months ago. And I think part of the issue here is communicating throughout the organization that we have protocols and procedures which are in fact proving to be effective, and we're implementing them. And so you keep people focused on, and again, from the standpoint of, if I feel like I'm maintaining control over my own health in this longer, I will feel more comfortable, I'll feel less anxious, I'll have fewer mental health issues to cope with because I am in control of this. It's like we teach people in R2MR. We refocus the thinking. What is it that you still control? What is it where you're making a difference? And so your own safety is being promoted by your own actions. So I think as leaders, we can continue to do that. Keep people focused on those things they can do and what we as an organization are doing that are making them safer, even as people return.
So Ron, isn't that just a really good example of how we interpret signals as a threat during the VUCA environment? So this person comes back to the workforce. We should have some confidence that they've been tested, they're clear, they come back, and we have all of those systems in place to protect us, yet we tend to go back to the threat. So again, I think thinking about how we decrease that level of uncertainty, here's a great example of it. How do we decrease that level of uncertainty for our staff and to reduce their likelihood to jump to that being a threat to them.
Right, and so you go back to, well, there's been the quarantine, there have been these tests that have been done, there are all these things in place that are helping to reduce the risk for them and for the rest of us.
But even more importantly, though, I think possibly is making sure staff are aware of what our procedure is going to be to bring somebody back before we actually do that and how we make that decision. So having that policy, that whatever it is, out to staff ahead of time if we can, so they understand if somebody's coming back, we've followed everything we can to make sure you're safe when they come back.
Right. And if you've missed something, somebody's going to say, wait a minute, you said we're going to do this and we didn't, so now we can do this and increase the safety. People are more comfortable.
I'm going to move us on to the next question just so we can get through the questions we do have. So how do we deal with differences experienced by members in the SAVE service? So there have been some differences in how provinces have rolled out things like pandemic pay for frontline workers, and even sometimes the hours are working, like whether you have to work overtime or you don't have to work overtime. So how do we deal with those differences experienced by members in the same service? And I'm going to start with you, Randy, on this one.
I thought you might. That's an incredibly difficult one. Particularly here in Ontario, if those aren't aware, our provincial government actually implemented a pandemic premium for frontline healthcare workers. So nurses, PSWs, and at one point in time, paramedics didn't seem to be included, but they're now included as well. So it's frontline paramedics, not management. So as an example of this disparity, we have some supervisors who are considered management working on a crew with another paramedic who is non-management. One's getting $4 an hour more than the other. So, obviously that's a significant issue. We have other, lots of other examples of where some individuals are receiving some type of different experience or I'll say benefit. And it is incredibly difficult. It's causing a lot of anxiety with some of these staff. And from my own personal experience, I've had to say to my staff, I acknowledge that. I understand there's a difference. I'm going to advocate for you. I might not be able to change it. At the same time, I do what I can to treat everybody the same. So they see from their leadership that we are trying to make sure everybody is treated in the same way. So that card that went out to everyone, some mental health tips and tricks that we've sent out to everyone, everyone has been treated the same when I can do that. But there are things that I cannot change, I cannot affect, and I have to acknowledge that that's a stressor. It doesn't feel right to my staff. And I'll tell them what I can do to advocate for it, but there are some things that I can't change, and I have to be open and honest about that if it's not in my control. Where it is, I will try to control it. Where it's not, I have to let them know that I can't.
Thoughts on this? Is that something you're experiencing in your organization?
Yeah, hi, Emily. I'm sorry you broke up there, and I'm hoping that that was on your end and not my end. Can you hear me okay still?
I can hear you just fine. It must have been on my end. So I'm just wanted to ask you
thank
if you had any thoughts. Go ahead.
Yeah, fortunately, so thank you. I owe you one because you went to Randy first, and I know it's certainly an issue there. I'm very fortunate to say that that has not been the same issue here in Alberta. So they have not implemented the increased pay or a pandemic pay here. There is talks of it. There was certainly something that came up, and it was of great interest watching our friends and colleagues in other provinces. It would have been even more challenging in my case because all of our staff are integrated. So my staff here are both firefighters and paramedics. And in some communities, as you know, paramedics were receiving it and firefighters were not. And so it really went down to, in our case, would have been extremely complicated. As for change of hours, I just wanted to point out in Alberta, there were some departments that did look at changing their hours. Some did, in fact, change their hours. So in Alberta, again, if you don't watch the demographics of shift patterns in our province, the 24-hour shift for fire in Alberta is not nearly as popular as it is in other provinces. It's the minority here for 24-hour shifts. But in COVID, there were some departments that successfully negotiated and agreed to go to 24-hour shifts on the fire side, and the rationale was around reducing the amount of exchanges with other staff or shift changes in a cycle. That will revert back to their regular 10s and 14s after the pandemic, or at some point when they recognize that that's not the same need. But for the most part, that was the only impacts that I had on the hours of work. But that pandemic pay, we blew really hard out of Alberta, and it stayed to the east.
All right, thanks, Ken. Ron, I'm going to start with you on the next question that we have.
Could I jump in on the last one just for 1 second before we move on? I'm sorry, I didn't mean to throw you off there, but I think one important point to this this previous slide about the differential treatment or experiences, I've had the good fortune of having medics complain to me about that. So somebody has said, you know, we're seeing in social media a lot of attention to the community paramedic side, not the traditional paramedic side, or complaining that they think that maybe community paramedics are getting different equipment. Or I think what's important in that point is having what I think is a psychologically safe environment where people will bring that to your attention. So you're not always going to have the answers, but being sure that your environment feels safe for people to tell you that they're experiencing that so that you can address it. So it's not only those things that we can easily identify as differential treatment or different experiences, but having a safe environment so people will tell you how they're feeling about that as well. I think that's a critically important piece.
I think you want to do that and also encourage them to say how that's affecting the work. Right? How is this affecting our ability to perform? And then, like I do with my kids, you turn that around on them and, well, what would you do to fix it? I think that's part of the issue here is that we've got a lot of very dedicated, very bright people working in public safety that understand the ins and outs of what makes their job work or not so much. And I think one way to deal with some of these differences in what they're experiencing is to say, oh, what do you think we can do about this? And what are the factors that are driving this? And like you say, some of this is coming out of provincial governments. It's not coming from the chiefs, and it's not coming from police boards, et cetera. It's coming from something higher up that you can't control, but maybe there's a message that can be communicated back, and somebody in your service has got a good idea of how to do that.
Ron, do you think that that's one of kind of starting to answer this question as well of during times of crisis, what can leadership do to ensure a good work environment? Do you think that that's valid as well?
I think what Randy's saying about creating a psychologically safe space becomes even more important now than it normally is. I mean, public safety operates in a VUCA environment, 24/7, 365. That's just the way it is. It's worse, or it's on steroids now. And I think because of that, it becomes even more important for leaders to focus on creating psychological safety within the teams. We need to trust each other. We need to feel that we can raise issues. What are the barriers for us to perform effectively? And those barriers could be that, well, if you go with R2MR again and you look at the mental health continuum model, I'm having a green day, a yellow day, an orange day. Now, just this notice that, hey, I feel like I had a bad night, I had nightmares last night, and I'm moving into a yellow or even an orange day. Well, maybe we need to provide you a little more emotional support today, or just, somebody needs to be there for you. So we need to have the openness that people can say that, but it can also be, Chief was trying to do a good thing, and he had these challenge coins printed, and the damn things all say paramedic. He doesn't appreciate those of us that aren't paramedics in service. And I need to be able to say that to him, right? And he needs to be able to own up, just like Ken said he was earlier, that I need to own up to the people that are working with me and for me that I don't have all the answers. I didn't get it right. You need to model that we're okay not having everything locked down and tight right now. And in fact, we want to show appreciation to the people that bring that up. It's not that we're encouraging people to be whistleblowers per se, because we want to normalize that raising problems is part of the job, and it's really important when we don't know exactly what's going on.
Andy, your thoughts on what's especially important during a crisis to create that good work environment?
So I think actually just building a little bit on where Ron was headed with this is acknowledging that it is a crisis. It is a time of crisis, and what we did traditionally has gone out of the window. It's, things have become much more complex dealing with this invisible threat. It's changed the way we're doing things, and all of that, acknowledge that that's a stress, and acknowledge that it's going to take us off of our, I was going to use cause us to make mistakes, and I don't want to use that term. It's going to take us off of our desired path towards an outcome. Now, something may go wrong, and that's okay. We need to say that to our staff where we can. You know, it's okay, and it's okay to tell me that something went wrong, because I'm going to try to work with you and work with our team to see how we can make that desired path towards our subordinate goal achievable in the future. So I think we have to, and as Ken said before, talk about our vulnerabilities. Mine as a leader, my staff as they address this complete unknown crisis, acknowledge that mistakes can happen, and I've got your back as we get through that. I think, you know, it's really important to have that message clear to staff. And what we'll see from that, staff are going to come to us and they're going to say, I deviated off of the desired path, this outcome, made a mistake, so to speak. And they're going to tell us, they're going to self-report, or we're going to get through things together, because they're going to have confidence in the leadership to have their back and not to critique and to you know, blame and shame as we may have in the past. It's a new approach, and it takes transparency, humility, honesty, and be a part of the team ourselves as leaders.
Final thoughts on this question to you, Ken.
Yeah, thank you. And I think I'll summarize it fairly succinctly. And something that I firmly believe in, that the two greatest risks during times of high need, crisis, are egos and lack of empathy. And unfortunately, when we're challenged with unknowns, when we're challenged with authorities, our egos seem to rise, and our lack of empathy seems to increase. And so I'm really repeating similarly to what Randy and Ron have both said too. It's about being open, honest, transparent. You know, the other thing I'll summarize really is live the values. And what I mean by that is all of our organizations have value statements, whether that's pride, professionalism, teamwork, and respect, whether that is a RISE principle, which we have here in the city, respect, integrity, service of excellence. Live those values, and you really have to model behaviors. If we're expecting our staff to do new, unique approaches to working every day, you're going to have to start modeling some of that yourself. And it's not easy, but it would be my advice going forward.
We are running a little shorter on time here, so I am going to take us to zip through the questions here a little bit, and we're going to have two last questions. So the first one is, what have you learned from phase 1 of COVID-19 that you can apply to a possible second wave or use in the future to help support the mental health of your workers? And I'm going to start with Ken on that one.
Well, thank you. And I know that we are running short on time, but this has just been a great opportunity for me to be a part of it. So I'll just start with saying thank you. I think we will know more now than we did prior to March of 2020. And I think we have to learn from that. We have to recognize what it's like to work remotely. We meet differently now. We've already talked about it, some of the changes that you put into place. We have to prioritize things so that the mental health continues to be at the forefront. As I think the really unfortunate reality is that budgets in municipalities will be challenged more so going forward than they ever did prior to COVID. What scares me the most of that reality is our dollars within municipalities are likely going to go to apparatus and equipment, and if you're lucky, staffing. Where you're still going to run into challenges is trying to put dollars into mental health programs within your municipalities. Yet I will argue, and Ron would support me wholeheartedly, that this is the time where we need to emphasize that the investment in mental health now will pay off 100-fold in years to come. So I think we face a challenge, but if we are aware of that challenge and we're ready to meet it head on, I would support putting some emphasis behind some mental health work going into the future.
Did I cut out again?
You did.
Okay. I'm just going to turn my camera off, and then that'll help out as well. So Randy, go ahead and your thoughts on this question.
So I think this probably connects back to that whole concept that Ken's also working on there, that concept of a psychologically safe environment, and starting to establish that early. And I think one of the lessons that we've learned that I think we would want to ensure we had front of mind as we go through a second wave is early engagement and involvement and transparency with our workforce. So you know, when you're making plans, or you're trying to respond to a crisis like COVID-19, you can't lob out ideas, see how they work, wait for the outcomes to come back to you, make adjustments. You need to be ahead of that. One of the ways that we were able to do that was early engagement of labor and our health and safety groups. We created a steering committee right up front. So this is what we're thinking of doing before we actually did it, and got their feedback, involved them in the decision making. It was, the transparency piece to that, talking to that group of representatives of staff to say, here's how short we are on some of these pieces of personal protective equipment that we have for you. Here's what we think plans B and C might be. What do you think of that? But engaging them and involving them in all of those decisions up front has been incredibly useful and increased the efficiency, I think, of our team as we went forward. But at that point in time, I think that's going to spread down in establishing that greater umbrella of psychological safe environment for the rest of the staff. They know they've been a part of our decision making. They feel informed. We've decreased some of that ambiguity, some of that uncertainty, and that's helped them to actually take inputs like, hearing that we're short on PPE and not immediately jumping to that's a threat to my life. It's to, okay, how can we engage in a response to that to keep us safe and get us towards the goal? So I think it was critically important in establishing that early, open, transparent connection for our staff to what our leadership decisions were going to be. I think it was really important. I think it's worked out well for us.
If I could just chime in, Emily, I know you want to go to Ron, and it'll only take me a second, but I really have to emphasize and agree with Randy wholeheartedly, and I was remiss in complimenting the relationship from our labor perspective here in our service. Lessons learned, I tell you, I will continue to include our labor representatives, our union executive going forward. They have been just fabulous in this process, and I've heard other very similar responses from other municipalities that the associations are working hand in glove with the management, going through some really tough decisions. So I will continue those conversations at a far higher level earlier than I did pre-COVID, and what I would do in a potential phase 2. So thanks for letting me just throw that back in.
No problem, Ken. It's a great addition. So I am just going to move to the last question. I'm going to ask it of Randy and Ken, and then I'm going to let Ron have a moment to give us a bit of a wrap up before we finish here. So the question that I have is, what's been your biggest challenge as a leader during COVID-19? And I'm going to get Randy to start first.
Sure. I'm going to go as quick as I can with this one, as I know you're challenged for the time. But one of my current biggest issues, I think, is that we may have missed some of the importance of sort of that mid-level and supporting the mid-level of our leadership team. So we've engaged them, we've run them red line on the tachometer for a long period of time, trying to help support the staff. And I think that we can do a better job of supporting that middle level as well, understanding that they are in an equally ambiguous and an uncertain environment. And they will tend to have those same reactions we spoke about before with our frontline personnel, with interpretational biases and the like. So I think it's a bit of a challenge to step back and ensure that we're treating all levels of leadership the same way as we would for our frontline staff, and ensuring they're in a safe and supported environment as well. So I think that's one of the challenges I would have recognized for my team.
Okay. And Ken, what are your last thoughts then?
Yeah, I think the biggest challenge as a leader for myself has just been the amount of change. In an organization where we are striving for some transformational change, we know, and studies will tell you, that transformational change does not happen rapidly. Yet we've been doing some significant major changes in our organization with very condensed timelines, and in fairness, without clear outcomes at the end of the day, other than to continue to deliver a top-notch service, as well as protecting our staff physically as well as mentally. And so it really has been the degree of changes within a very short period of time. And so it's about remaining empathetic and reminding us to stop and to Randy's point, engage with everybody. And I would agree 100%, great point, that we often are forgetting about a group of individuals that are pivotal to our organization's successes, but may not be on the front lines with the same risks as everybody else. So that would be my thoughts on that one, Emily.
Ron, I'm going to hand it to you for some final wrap-up thoughts. You got a couple minutes here.
Okay, well, with a couple minutes, I think one of the things that's encouraging for me from an organizational change perspective is that what we're seeing with the pandemic is a greater awareness of the need to make some transformational changes here around the health and well-being of public safety personnel. I think it's becoming clear, I think it was clear in the discussion today, that more and more leadership in public safety organizations is seeing this as a bigger systemic issue, that we need to involve all levels of leadership. We need to involve the front line with the executive. We need to involve the unions with the leadership discussions in this. And that's one of the biggest hurdles to get to transformational change for most organizations, is a common understanding that we need to make changes and we need to involve people. So I think this is really encouraging. I think we've got the opportunity here to really push forward an agenda item of improved mental health for public safety personnel all across Canada. I think there's greater awareness and willingness from leadership to do this. And I think now we just need to take some intentional actions to say, okay, what does this really mean? Let's set aside some time to think about what this more psychologically safe workplace is going to look like for us, and then take steps to implement that.
Final comments, Ron, I appreciate it. So everybody, we have come to the end of our presentation. I know I could have kept listening for another hour. You guys are great, and I really want to thank you for your support of this town hall. So after this session, a video will be emailed to the attendees tomorrow. There will also be a survey right after the session where we'd love your feedback. CIPSRT does not have permission to share the PowerPoint presentation, the slides from earlier that you saw today. But I want to remind people that our next town hall is June 18th. It is going to be titled "What the SARS Outbreak Taught Us About Psychological Needs of Healthcare Workers." So we encourage you to sign up for that if you're interested. A link will be provided in your email reminder tomorrow. Again, thank you to our panelists for coming today and giving your time so generously. And to everyone else, take care and stay safe.
We off?
I think we're the only ones left on.
Okay.
Ken.
You still there, Ken?
I am still here. Yes. No. Thanks so much for letting me play today.
Well, thanks for playing with us.
Yeah, you're welcome.
I appreciated your insights and your involvement.
It does still save the sessions being recorded at the bottom, so I'm not sure whether we are actually off or not.
That's okay. Yeah, we're going to meet again. Just so I'm clear, we're meeting in 1 hour and 30 minutes. So in an hour and a half, we're meeting again for the recap.
I'm checking my calendar.
Yeah.
Yeah.
Perfect.
So,
I'm sorry. You blocked out right when I needed to hear that. In an hour and a half.
So a Zoom meeting in an hour and a half. So hopefully we'll all see each other in that meeting.
Sounds good. I will talk to you guys in 90 minutes.
Okay.
Very good.
Thanks again.
Thank you.